nobody would come to beat him yet, have they? We wouldn't have nothing today if it wasn't for him.
He was a good man that had plenty to say for himself, but he did organise the national health, didn't he? Through the medical aid that we had here.
I think you'd be glad it's still going. I think, because it's still a free service, I suppose, I think he would be generally happy with the way it's going.
I had an operation in Neville last year. I was in for a week, and I've got to be totally honest, the staff there were remarkable. The ward I was on was exceptionally clean and tidy. They get a lot of bad publicity.
They don't say about the good things that are happening, do they? I mean, look at the people they are treating. I mean, there's millions. And I mean, they can't, the money isn't there, is it, to treat everybody as they'd like to treat them.
My mother had problems a few years ago where, due to glaucoma, she lost the sight in one eye. And ever since, we've had to go down every 5 weeks to have a cataract lens change. And fair play, they've been wonderful, no problems at all. They're always really welcoming, helpful. And they said to her, if she has any problems, all we've got to do is give them a ring. So I found it wonderful, and I think now Bevan was right. I do think there's a big problem, though, that there's too many management levels in there, and there's too much money taken up in administration, and not enough taken up with nursing and care for the patients.
All in all, the conception of the NHS is a good idea, but it's not too many hierarchy and management grades have been fetched in where the money has been spent on people not involved with the actual day-to-day running of the NHS itself.
I think the NHS are very good, because when I was 19 I had a major operation, and if it wasn't for them I wouldn't be here today. It's very good for people to be able to go and see their doctor and get the help that they need.
I treated my father recently and he died of a heart attack, but the care he had before that was fantastic. And I think the NHS is wonderful. Nothing bad to say about it at all. I'm not too sure about the resources and how it's run exactly, but the people that work there can't say enough about them. Fantastic.
I suffered a heart attack 4 years back, and the care that I received couldn't be bettered anywhere in the world.
I'll be 70 now in January, and I've been in hospital twice on 2 occasions for minor things, thank goodness, but they've always been excellent.
Free healthcare is something that this country stands out on its own. If you compare us to America, where you've got to pay for your healthcare, I dread to think if I got involved in a car accident or something, how much money I would have to pay towards my own healthcare.
There's not enough council houses. They need to be more built. There's people out there like my daughter, she's 20, can't get her own home because the mortgages are so expensive.
Young families can't afford to buy housing, but where do they go? Because a lot of council housing is no longer available because it's unfair. Fine, that's okay, but the government is not putting money back in to enable areas to redevelop.
I live in a council flat, but I bought mine years ago, which I was very lucky to buy at the price that I bought it. But there is need now again for more council houses.
Don't know too much about the benefit system, to be honest. I know that there's high unemployment in the area, and obviously with organisations and sort of, manufacturing organisations shutting down, there's need. There's a need for more jobs in the area for people to come off unemployment benefit.
They should raise the benefits. I know we're not supposed to be good living out of being on benefits, but they should raise the benefits enough to cover the cost of living at least. They talk about the people getting into debt, and you've got no other choice these days.
A lot of it you've got to do over the phone now, and go to the main office in Merthyr, which is inconvenient for a lot of people, and it's the thing of getting there as well. Some people rely on their money to get places, but then if their money's stopped and you ring them up, they expect you to just be able to get to wherever they tell you, or get to Ebbw Vale, or get to Blackwood, or wherever. And like, how can people get it when they haven't had their benefit, you know?
For me, I'm all right. I get a lot of benefits, you know, because I need a lot of things, but I think the benefits are all right.
I think education should be free. I think education should be free through university as well. You know, I think up until 21 at least, always used to be. Why are things changed so drastically?
There's not many places in the world that you can go and have free healthcare, free education and free support. And I do think we do forget that, and I do think we need to look back and think, well, 100 years ago you wouldn't have been able to live, and we can now.
We're going to Tredegarise you, is what Bevan said, and I think he did a very good job, and we're all very lucky.